I'm Sherry Dumford. I'm Director of External Affairs and Operations for HBMA. And in that role, I serve to support the mission of the Commercial Payer Relations Committee. Among all of the other challenges facing billing companies today and providers, still one of the most critical means to success is mastering the reimbursement workflow with the commercial payers. Key ways to ensure the most success with the commercial payers is really understanding the payer contract for the provider. The provider oftentimes allows the billing company to do the negotiating for them, and they work with them in that process. A lot of times, though, providers are doing their own negotiating, and billing companies don't necessarily have access to those contracts. So if you're one of those billing companies, you're going to want to make sure that you have access to the fee schedules and the other, understanding the other important components to the contract. Make certain to take advantage of all of the electronic options that are available when you're dealing with payers. For example, you want to make sure you understand a portal, if they have portal access, either their own portal or through a third party. You're going to want to make sure that you have access to electronic funds transfer and ERA for all of the providers. Getting those things electronically really is going to save you a lot of time. And I think probably one of the other best things to know and understand is that as we move into this changing healthcare environment, it's going to be critical, more critical now than ever, is to really have access to a system that allows you to have data analytics about what's happening with the individual payers and the plans for your providers. One of the ways that that can happen is making sure that you're talking to your practice management company to find out what they're doing to ensure that you're going to have the appropriate reports and analytical tools for them. HBMA provides a lot of tools for our members as it relates to the commercial payers. We have very strong relationships with most of the major payers in the country, and as part of that, we have ongoing conversations. In fact, we have standing calls with Aetna and United and Cigna, and in that, we really have a collaborative relationship because the payers are also having their own challenges as things are changing and as we're being required to adhere to standards and so forth. So we really have established a great collaborative relationship with most of the payers. One of the things that we've done internally is a member benefit for keeping track of the kinds of issues and problems that our members are having with commercial payers is we've created a web reporting tool so that they can go in and use and report if they're having problems with provider enrollment or problems with claims adjudication with particular modifiers or particular remark codes, or having challenges with appeals or reimbursement issues. They can go into this tool and report that so that the Commercial Payer Relations Committee can really triage the kinds of issues that are being reported by the members. It's an outstanding tool, and it's something that's available to our members only. And we've received a lot of good feedback from the members on that.